Assalamualaikum warahmatullahi wabarakatuh. Hi, I'm Firdaus Hafidz, and it's an honor for me to present economic impact of COVID-19 pandemic using Sleman HDSS Individual Panel Secondary Data Analysis in Biomic 2021. We will be very grateful if you could share your opinion or any feedback in the session, or you can contact us directly. As the background, as we know, all of us, that COVID-19 pandemic has been bringing down the economic globally and has a wider impact in overwhelming both the global healthcare as well the economic sectors. The production, processing, and consumption supply chain are also widely burdened by the social restriction and lockdown. The economic impact of COVID-19 pandemic resulted directly effects such as employment layoff, where the Bureau of Indonesian National Statistics revealed that 18.3% of workers were laid off, while 2.5% others were terminated from their job only at the beginning of the COVID-19. It is also declining all the travel business revenue, reduction of household goods and services. In response to the economic disturbance, the Indonesian government increased the allocation of the budget for the social safety net program and economic recovery. However, a study found that social cash transfers program didn't effectively as a result of poor information dissemination and data validations. Additionally, the pandemic also shifted how individuals allocated their expenditure. Also, the pandemic was encouraging changes in spending pattern. However, household perspective on economic impact given the variation among different social economic is still lacking. Therefore, we aim to have a snapshot observations on the economic impact of the COVID-19 pandemic in Sleman, Yogyakarta, using Sleman Health and Demographic Surveillance System, or HDSS, collected on the third trimester of 2020. But before we go into the methods, we would like to introduce you the Sleman Health Demographic Surveillance Systems, where the Sleman HDSS was initiated with the Faculty of Medicine, Public Health and Nursing in collaboration with the Sleman Regency District Office. Sleman HDSS follows 5,147 households for the last 5 years and updates their data annually. During pandemic COVID-19, Sleman HDSS conducted the 6th wave data collection using phone interview. And you can have a further information. You can visit our websites or scan the QR code. Going to methods, this study used data from the Sleman HDSS Wave 6. In total, 6,946 respondents participated in the 6th Wave Sleman HDSS. Data about demographic variables and the economic impact of COVID-19 and socioeconomic status merged with those respondents. The percentages used in this paper are weighted by gender and age group of the Sleman population. Thus, it is expected to represent the Sleman actual population. Respondents without records about data economic impact of COVID-19 and socioeconomic status were excluded from the sample. So we included 1,473 respondents in the data analysis. Some of the variables included in the dataset are sex, age, marital status, education levels, occupation, health insurance, socioeconomic status, location, and economic impact of COVID-19. Variable social economic status was collected in Wave 4, while other variables are collected in Wave 6. Respondents' income was evaluated in the study. We divide into 2 quantiles. We separated the respondents into 3 income categories: low, middle, and high income. There are 4 socioeconomic impact variables used, including employment, economic impacts, changes in expenditures, and type of assistance. This study used descriptive analysis to look at respondents' characteristics and changes in socioeconomic and health status during the COVID-19 pandemic. Respondents may report more than one type of assistance. Thus, the proportion presented was the percentage received by socioeconomic status. The study conducted post-stratification weighting to reduce sampling error and non-response bias. The study used binary logistic analysis to calculate the odds ratio. And we did all the cleaning process as much as we can in data analysis using Stata 16. Okay, so this is the first table. You can see that the characteristic of individual respondents of the study population extracted from Sleman HDSS in 2020. The response range age from 20 to 66 years old, and majority is male and mainly live in urban areas. They were mostly educated until the middle school level, which included either junior high, high school, or vocational school. A high percentage of married individuals formed in these study populations. Furthermore, wage laborers, entrepreneur, and household workers were among the 3/4 of the respondents. It is also shown that 87% of respondents own health insurance. Nevertheless, the respondents from low economic status surpassed the percentage of medium and high income status with 36 and 18% respectively. Table 2 shows the occupation status of the respondents according to their socioeconomic status during the COVID-19 pandemic in 2020. They mostly still work full-time, although they're not working. Respondents showed a relatively high percentage, while 19% of them were part-time workers. Only a small percentage of total respondents were laid off because the office was closed. The same percentage was discovered for the unpaid stay-at-home workers. Respondents with a low socioeconomic status had a greater influence on these two issues. 2.44% of respondents with low socioeconomic status worked from home without pay, and very small percentage also were affected by the low layoff scheme, 0.7%. Table 3 shows the individual respondents following the economic impact experienced during COVID-19 in 2020. So we can see here that more than 60% of respondents indicated COVID-19 created a financial impact. Nonetheless, respondents, particularly low-income families, were anxious of their job and household incomes. When compared to respondents with medium and high socioeconomic status, most of low socioeconomic status respondents are 2.5 times more likely to be concerned about losing their job, 3 times more likely to unable to meet their basic needs, and 2.5 more likely unable to fulfill their financial obligations. This group is also significantly less likely to benefit from the pandemic. On the other hand, in comparison to the high socioeconomic status group, the medium group fails the primary needs fulfillment and financial obligations expense 2.4 times and 2.0 times respectively. Table 4 shows the proportion of individual response to HDSS Sleman based on their spending during COVID-19 pandemic in 2020. Individual respondents of HDSS Sleman appears to have constant and increasing trend on their spending on average since COVID-19 outbreak occurred. Most of their increasing spendings were from health spendings, while the other spendings remained constant. Electric spending was found to have constant or decreasing trend in low economic status and constant and increasing trend in high socioeconomic status. The spending in oil, gas remained constant and or decreasing trend in high socioeconomic status, maybe due to the working from home. Mobile data package spending shows an increasing trend in middle and high socioeconomic status. Table 5 showed individual response of HDSS Sleman who received the following type of assistance during the COVID-19 outbreak in 2020. Overall, the assistance provided to these individual respondents, HDSS Sleman, dominated by cash assistance. Most respondents with low socioeconomic status are 3 times more likely to receive cash, 2 times more likely to receive foodstuff, and 2.6 times more likely to obtain the elimination of financial obligation compared to respondents with a high socioeconomic status. Medical checkup assistance is the lowest assistance received by respondents from all levels of socioeconomic status. Only 3% of respondents with low socioeconomic status and none all the high socioeconomic status receive medical checkup assistance. Therefore, the analysis of ratio cannot be done. So the low economic status experienced the greatest economic impact than other economic groups by the COVID-19 pandemic. However, only more than half of the low economic status population receive assistance from multiple sources. Government should have a better data and quick response to the need and economic impact due to COVID-19 to ensure equity in protecting the poor from the populations, particularly. So we understand that they have a limit. We have a limitation here, but despite the small number of households, this report shall give a glimpse of economic conditions at the early COVID-19 pandemic. Thank you for Sleman HDSS team and Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, who supported this research and activity. Here are our reference, and thank you so much. And you can contact us directly if there's any input.